Diabetes is a prevalent condition affecting millions worldwide, often presenting subtle symptoms that require careful attention. However, some emergency symptoms may indicate potentially life-threatening situations. Recognizing these symptoms can make a significant difference between timely, effective intervention and severe health outcomes. Here are 7 emergency symptoms everyone should know, whether they have diabetes or not. 1. Fruity breath. In the context of diabetes, fruity breath is a distinctive sweet or fruity odor emanating from a person's breath. It is not a common or benign symptom. It occurs due to high levels of ketones in the blood when the body cannot access sufficient glucose for energy due to a lack of insulin. Consequently, the body starts burning fat for fuel, producing ketones as byproducts. While small amounts of ketones can be expelled through urine, when production exceeds the body's excretion capacity, they accumulate in the blood, leading to a state called ketosis. As ketone levels rise further, the body attempts to expel them through the breath, resulting in a noticeable fruity odor. For a diabetic, especially one with type 1 diabetes, the presence of fruity breath signals a risk of diabetic ketoacidosis, DKA. DKA is a severe and potentially life-threatening condition characterized by extremely high blood sugar levels and a significant amount of ketones in the blood. Without prompt treatment, DKA can lead to dehydration, brain swelling, coma, or even death. The primary triggers for DKA include missed insulin doses, illness, or other factors disrupting the metabolic system. In essence, fruity breath is not a minor symptom but an emergency alert from the body indicating the onset or presence of a dangerous metabolic state. Recognizing and promptly treating this symptom can prevent the severe complications associated with DKA. Therefore, anyone detecting a fruity or unusual odor in the breath of a diabetic should seek medical attention immediately. 2. Rapid breathing or shortness of breath. In the context of diabetes, rapid breathing or shortness of breath is not merely an incidental symptom but an indicator of potential metabolic instability. Breathing is intrinsically tied to our body's need to maintain pH balance and regulate carbon dioxide, CO2, levels. When excessive acids accumulate in the body, it naturally tries to expel more CO2 to restore pH balance, which manifests as rapid or labored breathing. In the context of diabetes, this abnormal breathing pattern often signifies the onset of diabetic ketoacidosis, DKA. DKA occurs when the body, due to a lack of insulin, cannot use glucose for energy and starts breaking down fat instead, producing ketones. These acidic compounds accumulate in the blood, making it more acidic and prompting the body to expel CO2 faster, resulting in rapid or distressed breathing. This breathing difficulty is not just about the lungs working harder. It reflects the body's desperate attempt to counteract the dangerously acidic internal environment. As DKA progresses, it can lead to other severe complications, including coma or death if left untreated. For caregivers of diabetics, recognizing the link between rapid breathing and potential DKA is crucial, as it underscores the need for immediate medical intervention. 3. Nausea and vomiting. Nausea and vomiting, common symptoms of various illnesses, hold particular significance in the context of diabetes. Persistent nausea and vomiting in a diabetic individual can be harbingers of diabetic ketoacidosis, DKA, a severe metabolic crisis. When the body is unable to utilize glucose for energy due to insufficient insulin, it begins to break down fats for energy instead. This process generates ketones, acidic byproducts that, in high concentrations, can make the blood highly acidic. As ketone levels rise, they can irritate the stomach lining, causing nausea and vomiting. However, this isn't just a stomach upset. Nausea and vomiting are the body's attempt to expel these excess acids. Ignoring these symptoms allows ketone levels to continue rising, pushing the body into a state of severe metabolic acidosis that can impair various organs and bodily functions. For diabetics, Nausea and vomiting are not mere symptoms to be dismissed, but are alarms signaling a potentially dangerous metabolic imbalance, requiring immediate attention. Failure to address these symptoms promptly can lead to the escalation of DKA with severe consequences, including life-threatening complications. 4. Confusion or altered mental state. Confusion or an altered mental state in a diabetic is not merely a temporary concern but an immediate red flag, signaling potential metabolic instability. Our brain heavily relies on glucose, requiring a consistent supply for optimal function. Extreme fluctuations in blood sugar levels, either too high, hyperglycemia, or too low, hypoglycemia, can directly impact brain function, leading to confusion, dizziness, or altered consciousness. In the context of diabetes, prolonged hyperglycemia can lead to diabetic ketoacidosis, DKA. The elevated levels of ketones and glucose in the blood can impair brain function, causing mental state changes. On the other hand, severe hypoglycemia deprives the brain of its primary energy source, similarly resulting in mental impairment. These changes in mental state are not mere side effects but direct reflections of the brain responding to significant metabolic disturbances. In diabetic care, recognizing the connection between confusion or altered mental states and potential emergencies like DKA or severe hypoglycemia is crucial, as it highlights the need for prompt diagnosis and intervention to prevent further complications and safeguard overall health and well-being. 5. Weakness or fatigue. When a diabetic experiences severe weakness or fatigue, it is not just ordinary tiredness felt after a long day. It indicates an imbalance in the body's metabolic processes. Diabetes revolves around the body's ability to use glucose, the primary energy currency for cells. If glucose is not effectively utilized, energy production is compromised. In diabetics, when there is insufficient insulin or it is not functioning properly, glucose cannot enter cells for energy production, leading to an energy deficit. This situation is akin to a car surrounded by fuel but unable to get any into its tank. Despite being surrounded by glucose in the blood, the body cannot convert it into usable energy, resulting in extreme fatigue. Additionally, high blood sugar levels can cause excessive urination, leading to dehydration, a common cause of fatigue. Conversely, if blood sugar levels drop too low, hypoglycemia, the body again finds itself lacking necessary energy, leading to weakness. In the realm of diabetes care, this isn't merely a case of feeling tired. It indicates potentially dangerous glucose imbalances. Whether due to hyperglycemia or hypoglycemia, weakness or fatigue is a critical symptom highlighting the need for immediate assessment and action. 6. Abdominal pain. In the context of diabetes, abdominal pain is not merely a separate discomfort but an important indicator of potential metabolic distress. While abdominal pain can stem from various sources, in the context of diabetes, it often signals the severe condition of diabetic ketoacidosis, DKA. DKA occurs when the body, due to insufficient insulin, cannot use glucose for energy and begins breaking down fats instead. This process generates ketones, acidic byproducts that significantly lower the blood's pH, creating a state of acidosis. The accumulation of these ketones can irritate the stomach lining, causing discomfort and pain. This pain is not just a simple stomach ache, it indicates the body's internal environment becoming dangerously acidic. For a diabetic, abdominal pain, especially when accompanied by symptoms like nausea, vomiting, or fruity breath, is an alarm. It indicates the potential onset or progression of DKA, a condition that, if not treated promptly, can lead to severe complications. 7. Blurred vision. In a diabetic, blurred vision is not merely a minor eye issue but a sign of significant metabolic disturbances. The eye, particularly the retina and lens, relies on a delicate balance of fluids and nutrients for proper function. In diabetes, high blood sugar levels can disrupt this balance. When blood sugar levels rise, it causes osmotic imbalances in the eye lens, leading to swelling and affecting its shape and ability to focus, resulting in blurred vision. This is not just a temporary inconvenience, it reflects the eye's reaction to systemic hyperglycemia. Conversely, if a diabetic quickly improves blood sugar control, the eye can undergo changes again, causing temporary vision issues. Besides immediate effects, prolonged high blood sugar levels can damage the blood vessels in the retina, leading to diabetic retinopathy. Over time, this can cause significant vision problems or even blindness. In summary, blurred vision is a visual alarm indicating potential blood sugar irregularities. For diabetics and those around them, this symptom is not just a call for visual clarity but a prompt to better understand and manage blood sugar levels. Recognizing emergency symptoms of diabetes is not just a matter of information but of empowerment. These symptoms are the body's distress signals, highlighting moments when something critical is happening. This knowledge equips individuals, caregivers, and loved ones to act swiftly, ensuring diabetes remains a manageable condition rather than a growing emergency. 4.